most famous physical therapist on the internet.
Hi folks, I'm Mike Keenan's physical therapist assistant.
Brad Heineck, physical therapist.
And together we're the most famous physical therapists on the internet. Right?
Well, not quite. We've got, I noticed something different here. You're about 6 inches shorter than Bob.
What?
Bob couldn't make it today, so Mike is filling in.
Hi.
And he does an excellent job. We're happy to have him. Today's video, what's causing your foot pain? Question mark. And we've got 4 most common causes with some science research to help back this up.
Yes, but before we get into that, check out our giveaway section for this week's giveaway of a Sleepovation mattress.
That's right.
And some pillows as well.
Yeah, so here we got the mattress, 700 tiny mattresses. We got airflow in it. Both Mike and I found out we can sleep on our backs comfortably now after the mattress.
Yes.
Also, a pillow is going to be part of the giveaway. They actually have little springs in this pillow.
Yep.
And you'd never know it. They're a lovely pillow, but let's get on with the foot pain, Mike.
You can check us out on Instagram, TikTok, and Twitter for short versions of our videos, or pinned at the top of our Facebook is our giveaway and bobandbrad.com.
Yeah.
All right, now we're done with all that.
Mattress giveaway is incredible. So here we go. I did a little research on this, Mike. I wanted to find out foot pain. What are the most common diagnoses? What are the causes? The most common ones. So I found in the Physician and Sports Medicine Journal, 2004, Dr. Steven Stovitz, I think it's pronounced, and Dr. Chris Coetzee, hopefully I got the pronunciation right. They came up with 4 diagnoses. And what they found out was, and this is not surprising, is generally, can you come down here and look at my foot? Liz, thank you. All 4 of these diagnoses, they feel the common cause is a mechanical problem, and that the foot pronates or goes into a flat-footed position with weight bearing or the activity. So it's associated with flat foot. But don't worry, if you have flat feet, doesn't mean you're going to get these.
Yeah.
But that's their explanation. The 4 are, we're going to go through them 1 through 4, and I'm just going to go through each one. So you'll just have to, if you think this first one is not your foot pain, go to the next one. So number 1, this is a big one. I think every therapist or doctor will agree.
Yeah.
Plantar fasciitis.
This is the one we most commonly probably see in the practice field.
Yep.
Typically diagnosed with this. Honestly, of these 4, this is the one I know for sure, and the other 3 are I'm not super common with.
Right. Well, I've seen them, and I pretty much agree. And I talked to Bob about this last week, and he concurred.
Yeah.
So anyways, let's go to plantar fasciitis. Typically, the painful point, the whole foot can be painful, depending on how severe it is, but the primary source is this red dot right here on my foot. Liz said it looked like a little bit of blood, but don't worry, it's not. It's just a red marker. So right there, when I see a patient, I will palpate, and I'll go around here and I'll say, tell me when I hit the really tender spot. And almost always right there, they go, oh, that's it. So that's a common symptom that you can find on yourself. Also, a common symptom is getting out of the bed in the morning. And when you first put weight on it, it's very uncomfortable, and you limp around for a bit, but then it starts to feel a little bit better after a few minutes of weight bearing or walking. 2 common symptoms. We're not going to go through all of these in detail as far as treatment, because it would be a 20-minute video or 30-minute. We don't have that kind of time. So common treatments, Mike.
Cold bottle is a very common one. Take a pop bottle, water bottle, whatever, put it in a freezer, freeze it up, put it under your foot. And then, you're barefoot. Roll on it.
Yeah. Make sure when you freeze it, there's a little air at the top. Otherwise, it'll expand and break your bottle and possibly get water in your freezer.
Yep. And then another common thing is a night splint. It's kind of a splint you would put on your foot to keep it in more of a stretched position. You actually have one.
Yes, I do. We just did a video on the effectiveness of night splints for plantar fasciitis. So you could look that up. We just got it up maybe a couple weeks ago. Do you remember, Liz? Do you remember that one? Yep. See?
So very common things to do at home are just icing and doing some stretching. If you're seeing a therapist, they might either do I've seen iontophoresis or ultrasound or different
Right,
things as well,
right.
but just on your own, these are common
If
things.
you Google bobandbrad.com plantar fasciitis, you will get a number of videos will come up and explain a lot of different
You get a
treatments.
whole program series on it.
That's right.
So watch those.
Exactly. Number 2, posterior tibialis tendonitis. That's a mouthful.
That is.
Yeah. So if we break it down, what it boils up to be is the posterior tib muscle. Well, let's get Sam out here.
Posterior means back.
Yep. So,
Tibialis refers to your tibia.
there you go. So the back of the tibia. So it's in here. So in this area of the tibia, and then the tendon actually wraps around the back side of your malleolus. I got a purple line here representing the tendon, and it connects up to the navicular bone. That's that bone that sticks out on the side there. And what that muscle does is when it contracts, it helps support your arch.
Yeah.
So this all is kind of coming together here. So if your arch collapses too much, it can cause that muscle to overwork, and then that tendon can become inflamed, and that's the tendonitis part. So down in here, symptoms are if it hurts on the medial side or the inside of your ankle, and if you push on the back side, here's my malleolus or that ankle bone, and I push on the back side of it here with this finger, you may find that to be point tender there. Good sign that that's part of your problem, or it is your problem. So, Mike, you got any clues for what you would do with that?
Well, you would probably put in a type of foot support
Yes.
or brace.
Yep, you can add in some kind of arch support. You don't have to get a custom one. You can just try getting something off the counter at online or at the local foot store, and you're going to put it like this is the insert from here. You will probably put it underneath the insert. Sometimes you take this one out and put the whole one in. Depends on what you're buying, but that supports that, allowing that tendon to have less stress on it, therefore getting it better. If it's real tender, you can put a cold pack on it. Do that a couple times a day, and just be off of it. Activities that irritate it, back off on them, if you can.
Take some rest, strengthen the muscle a little bit too. Tibialis posterior typically inverts, so meaning it brings your foot in. You can do some just gentle range of motion if it's really painful.
Yep.
You can always add some TheraBand for resistance if you really want to strengthen it.
Sure.
But those are just some common options.
Yep. And I believe we have a video specifically for this. I know we do. For if you go Google Bob and Brad, flat-footed or posterior tibialis tendonitis, that should come up with much more details on the exercises. Number 3, Hallux valgus.
You take this one.
These are all the medical terms. You'll know this more as people end up getting what's right here, Mike? They call that
bunion.
Bunion, exactly. What happens is if you look at the line on my toe, I know this. My sister had this. Is the toe ends up going, valgus means out. Hallux refers to the great toe, and it goes out this direction. So, and a lot of force gets put on this part of the foot. That causes the bunion, and it can get bigger, and the toe can actually go valgus more over time. It creates a real pain problem with walking.
My dad had that. His dislocated, actually.
Oh, wow.
Yeah, he had to have surgery to get his bunion cut down.
Oh, wow.
Yeah.
And your dad has it, and I found through the research they find that 10 times more women get this than men, but there's a good reason.
I don't think this is the reason my dad had it either.
These types of shoes right here. This is my wife's shoe. She was fortunate. She said, "Go ahead, use it." I can't do anything. It's one of her older pairs. I call them high heels, but I guess back in the day, they called them pumps. Yeah. But Liz, she's younger. She says that's kind of outdated. But anyways, if you imagine, what are you laughing at? If your foot is in here and we got your heel elevated, your weight bearing compresses the forefoot, and you can see this actually forces. It's like putting a brace on your foot or your big toe to move it in the wrong direction. It puts it out of neutral. And over time, if you wear these for years on end, you can develop the same problem that we just talked about. That hallux, big toe pointing inwards, then going to a bunion. So the best way to treat this, we really don't have a physical therapy regimen for this, is change your shoes.
Yeah,
You're
get
gonna
out
have
of
to.
them.
Sorry, but the pumps are gonna have to go.
Yeah.
Make sure you have wide forefoot or the toe box in the shoe, so things have room in there. We take that stress off of there. If the bunion is too bad, you have to go to your podiatrist. They have ways to take care of that as well.
Mine actually goes in a little more.
Well,
compared
good.
to
So you got
yours.
room. You could wear some pumps, and they'd be all right.
I don't think that size will fit me though.
Well, I hope you're not considering it. All right, and last but not least, another medical term: metatarsalgia.
So your metatarsal heads are this part of your foot, basically. You have 5 of them.
Right. So it's on the bottom too. This refers to pain on the bottom. Now, Mike, you just mentioned you had a little episode of this, but the location of your pain.
Mine was on the 5th metatarsal head. It was the opposite foot, but I had recently gotten some different shoes, and I was trying out for the first time on a 6-mile hike and an 8-mile hike in the mountains. So not the best way to break in some new shoes. But I had some really annoying pain afterwards for a few days. Now I don't wear those shoes, and I'm fine. So.
Which oftentimes is the case with this diagnosis. And in my case, I have pain right here. I put another red dot here. And if you have it right there below your 5th digit or the second to smallest toe, right about this location, and it hurts with walking, with weight bearing, it very likely could be Morton's neuroma. There's a nerve bundle in there, and it's a mechanical issue. If your toe box is too tight, that can irritate it. I have some other shoes that if the base of the foot where the insert is not shaped properly, puts pressure on there, and it gets very painful.
Yeah.
The nice thing about it is if you take your shoe off, pain goes away, or quit walking on it, take the weight off it, pain goes away very rapidly. What I've done with my shoes, and we got a video on this too, is I take my insert, pull it out of my shoe, and where this orange is, I put in a cushion there, and that takes pressure. Instead of going on the Morton's neuroma, that nerve bundle, it puts pressure in the arch. So you're just changing where the pressure location is. And it works quite well. And I just keep them in there. I put some tape over it so it doesn't move. And I have great success. We do have a video specifically on that. Actually, 2 videos on Morton's neuroma, details on how to fix that. You can also, if it's really sore, and I've done this after I've irritated it and it feels better, but it's still tender, I'll put a cold pack on it, put my foot on a cold pack while I'm, reading something or watching the tube. It's not a tube anymore. It's a flat screen. You can't say tube. Back in my day, it was a tube. Right. So anyways, those are the things that are going to help. Sometimes just a cushiony base, insert without the custom-made cushion can be adequate. So that's it, Mike. 4 diagnoses for foot pain. If you went through all of them, there's a good chance that your foot pain is from one of these. Yep. So anything else? Did we miss anything, Sam?
I don't think so.
All right, very good.
We still can't fix a broken heart.
Right.
We're working on that.
What, you got to say that. You say, we can fix just about anything except for
a broken heart.
There you go. But we're working on it, and good old Sam. Yeah, he's not going to help.
No, he doesn't have a heart.
Yeah, take care.